Meet Uncle Lim. He's retired, cheerful, and enjoys little things in his life. He loves making food for his family and catching up old friends over kopi. One day, Uncle Lim noticed a small lump in his neck. It does not hurt, but it does not go away. So inside our body, we have little guards called the B cell and the T cell. They protect us from sickness by fighting germs. But one day, one of the B cell gets a tiny mistake in its code, like a typo in receipt. It forgets to stop growing, and instead of helping, it crowds in the lymph node and makes trouble. And this is how the non-Hodgkin's lymphoma begins. Lymphoma is a cancer that starts in the lymphatic system, our body's cleanup crew. It often begins in the lymph node, where the B cells grow uncontrollably due to a genetic mutation. Not all lymphomas act the same. Some are like wildfire, fast, sudden, and obvious. We call those the aggressive type. They grow quickly and often cause a big changes in a short time. Others are slow and quiet. They grow gently and sometimes over months or years, and people may not even notice the symptoms at first. They are called the indolent lymphoma. Both kinds are treatable and they are different, and doctors use the different tools to help. He did not feel very sick at first. Nothing dramatic, no sudden collapse. But there were little clues. A small sign that something was not quite right. A small lump in his neck, and it does not hurt. So he thought it was nothing. He would also wake up in his damp shirt from the night sweat, and even though the fan was still on. He also started losing weight, even though he was still eating his usual kaya toast and drinking coffee every morning. He also felt more tired than usual, not the kind of tired after a long day, but a deep kind of tiredness that did not go away. But slowly, these clues were pointing to something more. So Uncle Lim felt something was not right, and he decided to see a doctor. The doctor noticed a swollen lymph node and sent Uncle Lim for a few tests. First, a scan, a PET or a CT scan, which helps the doctor to see if the lymphoma is hiding elsewhere in the body. Next, the doctor takes a small sample from the lump, and this is called the biopsy. It may sound scary, but it's actually a simple and safe procedure. With these tiny pieces of tissue, the doctor can look at the cell under the microscope and see exactly what kind of lymphoma it is. This helps them to choose the best treatment for Uncle Lim. They also do some blood tests, and this test tells the doctor more about how well Uncle Lim's immune system is working, and how his white blood cells, red blood cells, and platelets are doing. It's like getting a full health report so they can make sure his body is ready for the next step. So all this information helps the doctor to understand what Uncle Lim needs. The test is confirmed. Uncle Lim had a lymphoma, but it was found early, and it makes a big difference. Uncle Lim was worried, but the doctor explained there are many treatments and a good chances of recovery. Once the doctor knows it's lymphoma, they can start helping right away. First, there's chemotherapy. This is a strong medicine that moves through your body to stop the cancer cells from growing. It works well, but it can also affect other fast-growing cells, which is why other people sometimes feel tired and lose their hair. If the lymphoma is only in one spot, the doctor may suggest radiation therapy. It uses a focused beam, like a flashlight, to shrink the lump. There's also immunotherapy, which helps your own immune system, especially the T cells, to find and destroy the lymphoma cells. It's like giving your body a little boost to do the fighting. And if the doctor finds a very specific mistake in the cell, they may use the targeted therapy, a smart drug that helps to attack only the bad cells and leaving the good ones safe. So these are the smart medicines that go straight into the cells with the mutation and leaving the healthy cells alone. Uncle Lim and his doctor talk together to decide what works best for him, and everyone's treatments will be a bit different, but the goal is always the same, to stop the lymphoma and helps you to feel better. When someone finds out they have a cancer, the first question is often, why me? And after hearing about the treatment, Uncle Lim sat back in his chair, quietly thinking, was it because of his food, his lifestyle, or did he did something wrong? But the truth is, lymphoma often does not have a clear cause, but the doctor have found that a few things might raise the risk. First, age. As we grow older, our body goes through more wear and tear, and our immune system does not catch problems as quickly as before. This makes it a little easier for mutated cells to slip past. If the immune system is weakened, maybe from past illness, medication, or just stress, it might not fight off abnormal cells the way it used to be. And sometimes, it just happens. A tiny mistake in your body's cells instruction, not caused by anything you did, not something you could have been prevented, just random. That's why it's important to not blame yourself. You did not cause this, but you can face it with help, with care, and with courage. Uncle Lim did not walk this path alone. His family stood by him, cooking meals, keeping him accompanied during treatment, even learning how to help him to feel more comfortable. His friends also brought him laughter and small joys, reminding him he was still the Uncle Lim, the kopi master, the story king. The treatment was not easy. Some days were tough, but slowly, bit by bit, Uncle Lim gets stronger. After some time and care, Uncle Lim began to feel better. His treatment worked. The swollen lymph node shrank and his energy slowly returned. After his treatment, Uncle Lim came back to the clinic regularly. Not because he was sick again, but because keeping watch is part of staying well. Doctor checked his blood, did scans, and made sure his body was healing and staying healthy. Soon, he was back to doing what he loved, cooking, drinking coffee with friends, and enjoying his golden years. He also made a small changes, eating a little healthier, moving more, and listening to his body. He still laughed, still told stories, but now he knew how strong he really was. Uncle Lim's journey reminds us, when something does not feel right, it is okay to speak up. The earlier we notice the lymphoma, the better the chance of recovery. So take care of yourself and check in on your loved one too. Lymphoma does not always come from something you did wrong, but often just happen. It may be related to age, a weakened immune system, or sometimes it just happen random. But the good news is, if we catch it early, it can often be treated, and many people like Uncle Lim get better. If you notice anything unusual, don't wait. Talk to your doctor. The earlier we find out something like lymphoma, the better the chances of treating it successful. Remember, having lymphoma does not mean the end. It is not something you cause, and it is not something to be ashamed of. As Uncle Lim has shown us, it can be faced with courage, support, and proper treatment. It is just one chapter in a much bigger story, and with early care, love from family and friends, and modern medicine, there are a brighter page still to come. Now, let's take a moment to remember what happened to Uncle Lim. The non-Hodgkin lymphoma started as something small, a lump in the neck that does not hurt. Other signs might be swelling in your neck, armpit, or groin, feeling extra tired for no reason, and losing weight even if you did not change your diet. Neck sweats or fever that comes and go. This sign can be easy to miss, and that is why it is important to spot the symptoms. Thank you for spending time with us. We hope Uncle Lim's story helps you or someone you love. Stay curious, stay kind to your body, and never be afraid to speak up for your health.